Yeah, thanks, Mick. This is Glenn Poole. For those of you who don't know, CEO of the Australian Men's Health Forum. Waiting for our president who's scheduled to launch today, but I'll just ease into our formal opening. I've got the wonderful screen arrangement where you can see everyone. I'm just noticing. Firstly, it's really lovely. We spent Men's Health Connected was born out of COVID because we should have had our national men's health gathering May last year and very quickly had to go online for reasons you'll all be aware of. You may have heard there's been a bit of a pandemic. So this is our second time in the world of Men's Health Connected, and looking around the screen. Firstly, I noticed many familiar faces from last time, which is really great to know that you loved it so much you've come back for more. I also noticed some faces that I don't know, which is great to see that we're attracting new people to this space and to this conversation. And the same goes as I flick through the three screens we've got now of participants as we get up to 60 people, where we get more like names and avatars and things. And there's lots of names and avatars, which I recall from the past. Great to see you here again. And again, lots of new names and new avatars. So great to make new acquaintances, great to refresh old acquaintances. And one of the names and avatars and faces I'm not seeing is Greg Milan, our president. I did ask him quite late on if he would just open up the session. So I'm going to take on that responsibility as it's 9:31. So I'm going to start by acknowledging the traditional owners of the lands where we meet from today, all around Australia. I join you from central Queensland on the traditional lands of the Bundabung, the Gurang, the Balai, and the Gurang mobs. Very close to a town called 1770, which you'll guess by its name as a very kind of plays a very key part, is very symbolic in terms of our shared history on this island. The next thing I want to say is welcome to Men's Health Connected 2021. We've got a whole week of events covering a whole range of topics. Men's health literacy and promotion tomorrow. We've got men's health champions, the sector connector, bring together people who work in men's groups and men's organizations on Wednesday. Thursday, we're focusing on nursing and men's health. Friday, we're looking at working with different populations of men in all their diversity. But still top of our agenda is the very important issue of men's mental health and male suicide, where we'll be appropriately starting the conversation today. Just a little note on this particular conversation. Whilst we're broadly professionals and workers in the space, I'm sure you'll all be aware that the topic of suicide can take us by surprise and can be a tough conversation to have. And sometimes we can really struggle with that conversation. And if today is one of those days where you're struggling with this conversation, then do please use Zoom here to reach out to our support staff. You'll see those of us who have the Men's Health Connected background, we're all on staff in different ways. You can reach out to any one of us and we'll point you in the right direction. Liam or Robin or Mick or myself or the chair of the or the chair of the session. Or you can reach out to us through events@amhf.org.au. I'll drop these, make sure these emails are dropped into the box. Or for technical stuff, you can also reach out to the support team. Who I will drop that
support
email
Sprout
in the chat
Labs
box as well.
Yep.
Yes, Sprout Labs. Yeah, just drop those in the chat box. That's all I really want to say in terms of welcoming you to the conference and the day. I'm now going to change hats. I am a man of many hats. I wasn't expecting to wear this particular hat today, but I'm now going to do a quick change so that I can join the panel of the next session. I'll be going off to the changing room over there. And whilst I do that, I'll hand over. You won't recognize me. I'll bring face hair or a hat or something to make it, interesting for you. I'll hand over to the very capable hands of Mr. Peter Shmigel, who's going to chair this session. Just going in that direction.
Good morning, everyone, and I join Glenn in acknowledging that I'm on Indigenous land, always was, is, always will be. I'm on the land of the Batamagal clan of the Darug Nation here in Western Sydney, or Parramatta in specific. I want to reinforce Glenn's message about making sure we look after ourselves during these sessions. They do catch you by surprise sometimes, even if you are part of this conversation and close to the content around suicidality all the time. It can still, whack you when you least expect it. So please make sure you're looking after yourself. You're reaching out when you have to. Right. How do you introduce a session about male suicide? Well, the usual practice is that we list all the statistics. All right. We talk about the 75% of suicides in Australia every year that are male, and we go on. And we have more and more of these statistics. And you know what? For those of us who have been involved in this stuff on and off for a while, it almost becomes desensitizing. We know these numbers so well. We've seen this data so often that there's a risk that we kind of fall into like a malaise around the numbers. So one of the things I would ask everyone to do today, including myself and our panelists, is let's not forget the fundamentally human dimension of this, the pain, the suffering of people going through, men going through the experience of suicidality, of the people around them who are caught up in the ripple effect of those 2,000 plus deaths every year. Yeah, let's hold them in our hearts as we go through today, yeah? Okay, we have an opportunity today to get current on where public policy is at in terms of male suicide, where practice in terms of programs and research are up to in terms of male suicide. And the reason we can do that is because we have some really exceptional people who are going to share their perspectives and their knowledge and their wisdom with us. And I would like to introduce them. First of all, we have Dr. Zach Seidler, who's a clinical psychologist and the director of mental health training at Movember, the global men's health charity. And Zach is also a research fellow with Origin at the University of Melbourne and a generally nice guy. I always think of Zach as living in a couple of different worlds, his world of private practice and his world of research. So he brings some very comprehensive perspectives to this issue. Secondly, we're very delighted to have with us Dr. Bernadette Boss, who is the inaugural National Commissioner for Defence and Veteran Suicide Prevention, as recently appointed by the Commonwealth Government at Prime Ministerial level. So she was appointed in October 2020, and this is a very large and new milestone when it comes to male-related suicide, to have this position and this structure and somebody as capable as Dr. Boss in it. Thirdly, we have Darren Black, who, in addition to his most important qualification, that is he is a board member of the Australian Men's Health Foundation together with myself and others. Darren is the CEO of AusHelp, and AusHelp is a long-standing program now that does very practical support services in high-risk male-dominated industries like construction, mining, transport, farming. He's also a military vet, which ties into Bernadette's cause, if you will. And yeah, Darren has been out there at the coalface working with men on a daily basis for quite some time. So again, brings a specific perspective. And finally, and this is kind of interestingly historic in some ways. I'll say why. Christopher Stone is the Acting Director of Policy and Government Relations at Suicide Prevention Australia. He's held many policy and research analysis roles in the community sector and government at both national and state levels. Christopher will no doubt tell you about the fact that SPA is currently developing a male suicide policy, effectively, that consists of a lot of consultation with many different stakeholders. And why that is interesting and historic is because it's the first time that SPA has done such a thing. So it's great that the overall peak body for suicide prevention advocacy is now very much supportive and aligned with the notion of male-specific initiatives, if you will. for those of you who have done this for a long time, you'll know that that hasn't been the case. So it's wonderful that basically we're seeing this kind of acceptance, maturation, insight from a whole bunch of different bodies. And I think that's one of the characteristics of where we're at, but I'll let the panelists speak to that. Okay, I'm going to ask some framing questions of the panelists in 1 second. But before that, I'm going to say a sentence that none of us understood 24 months ago, and that is, use the chat function in Zoom to put up questions. We've learned a new language. Extraordinary, right? So look, do use the chat function. I'm going to draw from the chat function questions to put the panelists as we go through, et cetera, et cetera. But before we even do that, can I ask everybody to do 2 things on chat right now? First of all, write down what you want to learn from the panelists today. I'm actually waiting for you to type. The numbers are growing.
Hang on.
Yeah, okay. Awesome. I'm going to mute you really quickly because
Okay, I'm getting some feedback now. Ross Steen, best practice. Kate, how to provide a better service for men. Yeah, interestingly, how do you design male-friendly service delivery? How to talk to others about suicide. At the heart of everything we do is that conversation. Rural areas. What's specific to male suicidality as opposed to female suicidality? Fascinating question. Why? The ultimate question. Why do men die by suicide? What is being specifically done in the mental health arena for men in Australia outside of the gentleman's experience? Again, we have the theme of rural areas and farmers coming up a second time. Culturally sensitive approaches has been noted. Here's a good practical. What are the 3 key things to do in an imminent suicide crisis? So look, I'm seeing the role of lived experience, and I'll put my hand up there. So we're seeing a mix of folks coming in at kind of a very practical level and also at kind of a meta level. So speakers, that's part of your challenge today, is to speak at that kind of tell me what works kind of level, and also at, you know, where is the general debate about suicide, male suicide up to, and where does it need to go in future? Yeah, good challenge. Okay, so without further ado, I'm going to put a question to all of our speakers. I'll ask them to make some introductory remarks about themselves and their work, and then I'll ask them to comment on the following question. What's the most empowering aspect of your current work in male suicide prevention? And what do you really want people in this audience to know about your current efforts and how you believe they can make a difference? Okay. What really motivates you, makes you optimistic about what you're currently doing in terms of male suicide prevention? A, B, how can folks in this audience help you on that journey that you're on towards the goal of male suicide prevention? So maybe we start in the order that we introduced folks. Zach, would you like to kick us off from sunny Melbourne?
Sunny, there's no such thing. Never. It's always grey and miserable. Lovely to see everybody. This is a bit of a year-round frat party of sorts now. It's just all my friends in one place. So it's lovely to see all of these very familiar faces. Hopefully, while my tune probably hasn't changed, the story is slowly shifting, and the fact that we're here year on year is beautiful to see, and the fact that we have a community now that is growing in strength and in volume is deeply empowering. So I'll start with that, which is the fact that the community as a whole, the amount of times that I'm asked to speak on this topic in various contexts, and the types of audiences that I now get to speak to, compared to 5 years ago when it was just me and Glenn in a small room, is, no offense, Glenn, I love those times, but it's really empowering to see the interest. And I think there's something that's really important. And I've spoken with Chris at SPA about this and various other, national bodies and institutions, is that we need to come at it from multiple angles. I'm very lucky that I wear 3 hats, really, in many ways. I'm a clinician researcher, and I also work, pretty heavily in advocacy at Movember. And so that means that I can find a way, depending on the room, to tell a different story to the audience. So the most empowering thing, it would be remiss of me not to say that the most empowering thing is my clinical work, because hearing people's lived experiences and working with them through that is deeply moving and powerful for me, and to see progress. And I would say specifically working with young men and seeing their potential, their desire for change, their desire for knowledge, and their ability to adapt when provided the space to speak openly and honestly. The problem, I think, at the moment is that those spaces are very difficult to find for these young men. And so I'm doing my best, and I'm sure that everyone in this Zoom room, is doing their best as well to create a space where men can go, where men can feel held, understood, and can consider their own lives within the context of the cultural moment that we're in. Something that I find really interesting is that, and I've spoken endlessly about this, is that we need to move away, and this is what I mean about having multiple voices. And I'm really glad to see the way that we're talking for the next 5 days about this topic is not, and this is where the progress has come in, not purely about help seeking. We're not purely going, everyone needs to seek help, because we're now coming to terms with the fact that lots of men are seeking help and that it is still not working. So that's really where my efforts lie at the moment, which is, and I saw that someone asked before around best practice. I'm doing my utmost to try to upskill the workforce to understand male strategies to actually, engage guys in treatment, what it should look like, how it should work. And in fact, the most important thing really in my eyes is making sure that when someone comes through the door, we can hold them there, we can keep them there, and that we can make sure that they're on the road to recovery. Because the investment that is taken to get a guy through the door is astronomical, and to waste that opportunity, my research has shown over and over again that if a man has a shit time in therapy, they're gone. They will not come back, and if we lose them, it ends catastrophically very often. And we've got around 60 to 65% of men who suicide have sought help in the months prior. So this idea that it's purely happening out of the blue in many instances is not the case. I see so many guys who are reaching out, who are seeking help, and I'm sure Bernadette will talk about this. I see endless veterans, first responders who happened to seek help 5 years ago. They had a really bad experience. They then somehow, thankfully, made their way into my orbit, and they get a second chance. But this is at the point of crisis, when really they should be hospitalized and they're really unwell. And it's taken that trust to really get over the line. So I'm hoping that in coming years, when someone reaches out for help, when someone talks to their family members, when someone talks to their friends, they know how to respond in a way that is empowering, not stripping the man of control, stripping the man of any sense of autonomy, or feeling like he can overcome this thing with everyone's help. So multiple hats, multiple angles. And I think that that's the way that we're going to tackle this as a group, is to share our experiences across the board, and really talk through the diversity of men's experiences as well. Long spiel for Pete Shmigel. Thank you.
But a really powerful one. One of the things that I heard Zach say is that men are seeking help, but it's still not working, which is kind of a a profoundly worrying kind of phenomenon in that respect. And we should be thankful for his work in terms of upskilling the workforce to actually hold those men once they do present for help. And I actually might circle back to you, Zach, with the question, what are some of those key upskilling strategies? Okay. And now let's move to our second panelist, and that's Dr. Bernadette Boss, the newly appointed. Dr. Bernadette Boss. Bernadette, what's inspiring in your current work to you in terms of the new project and very welcome initiative? What do you want us to know about it? How do we support what you're trying to achieve in terms of male suicide prevention? Bernadette? Organizers, can you check for me? And I do see Bernadette there.
We were having issues earlier. All right, let's just have a quick look.
Okay, no worries.
She managed to get in, but maybe we can move on to another speaker.
We shall do. Darren, you are there, yes? Darren Black.
Hello, Peter. Yes, I am here. And
excellent.
Can you hear me?
I can, and I hope the others can too. So to you, Darren, what's really kind of exciting you about the work you're doing at Oz Help at the moment? What are you seeing that's working? What do you want us to know about it? How do we get behind it?
Yeah, thanks, Peter. First of all, let me say great to see you in high vis, Peter. As some of the audience might know, there's Bernadette just coming in there now, I see.
I'm here, I just can't be heard.
Yes, you can.
Yay! Okay, thanks.
Peter, do you want to go back to Bernadette?
I think she probably didn't hear the intro, so let's stick with you, Darren, and then we'll circle back to Bernadette, okay?
Thank you. Look, great to see you in high vis. OzHelp works, both our staff and clients that we serve in those industries of mining and construction and farming and truck drivers and so on. I mean, often we're working with people in high vis like that. So, look, there's a bunch of work we're doing at the moment that I just want to touch on with you today that we're really proud of. It's using a couple of, I think, of those key principles of male-friendly health services in targeting men directly and taking the service to them. I'm talking specifically about truck drivers on a national project we're just rolling out at the moment. I'm talking specifically about men in rural and farming communities and taking those programs to them. And I'll try and talk to a little bit of the how and respond to some of the questions that have already been raised in the chat room specifically about that. So we've done a huge amount of co-design work and consultation with communities in transport and logistics recently to take a very specific targeted intervention to support truck drivers nationally. And there's online elements of that. There's health tips that they can access digitally. There's ambassadors speaking and pushing out content on our behalf, talking about the importance of sleep and social connections and diet and exercise and nutrition and all of these, positive health aspects, and dealing specifically with how to help truck drivers remain safe and healthy in what is one of the highest risk occupations and cohorts nationally. So that's a piece of work that we've been doing in partnership with the industry and with the National Heavy Vehicle Regulator nationally. And a key part of that is going to be roadside health checks, which we commenced this week at the truck show in Brisbane. And then they'll be rolled out at key nodes, at key truck stops where we'll have nurses and wellbeing support workers on the roadside there to go to the places where the truck drivers live and work. And we've taken this approach because of the feedback we've got from drivers that one of the key risk factors was isolation and they're so time starved and time poor. If for this service to be effective, you've got to take it on the road and you've got to take it to them. The other one that I think is really exciting and a huge area of need is in rural and regional communities and supporting farmers directly. We've had teams recently in southwestern Queensland in some of the black spot suicide, regrettably, black spot suicide communities of Australia in the Darling Downs, in places like Longreach, Kingaroy, Chinchilla, Gundawindi, regional communities like that. What we've learned really quickly working with those communities is that there is a significant gap in coming to this question of why and causal factors and taking a systemic approach in response. Often, and again, we're often talking about men in the highest risk cohorts, that when they do reach out for support and assistance, there's often a gap in terms of their ability to access services. And I'm talking about enough GPs and access to counselling services. And so what we're finding commonly is that when a bloke in those sorts of communities does reach out for help, and it could have been a long time, a hard time for him to get to that point, noting the sort of culture and environment and stigmas we're talking about, that often then it can be a case of a referral to counselling support in Toowoomba, a regional centre 2 or 3 hours away, or Brisbane 2 or 3 hours away, and put on a wait list for 2 or 3 months. And, you know, to Zach's point, we know that often that's just inadequate and can often be too late. So we're working now in conjunction with local government agencies up in that southwest part of Queensland, with the Primary Health Network, and looking with local business and philanthropy at taking a multi-sector approach to mental health support teams interventions to come in there and provide a bridge essentially between those in need and the gap in terms of primary healthcare services and support. So that's a really exciting developing piece of work that I just wanted to share with you and say I think we're developing a model here that can be sustainable, but it is going to take government support. It is going to take industry, business support. We are looking for philanthropic investors, and we're already finding them who are invested and interested in making a difference in this space. And working in some of those communities, with the highest risk evidence, the stats are the highest risk communities in Australia. So that's some of the interesting, important, and exciting work that AusHelp's involved in at the moment. We're learning a lot through the process, and one of the great things I think is this. If you take the time to listen and understand and ask questions and engage with the community that you're trying to serve, we've all heard of this concept of co-design, but it's been hugely important to the development of some working models that we're starting to see results with, and we think will make a difference in the long run.
Thank you, Darren. And some really interesting things there. For example, about taking services to where blokes actually are. The notion of the roadside health checks. I mean, if there's any place in the world that's lonely, it's a truck stop in the middle of nowhere at 3 o'clock in the morning, for sure. And secondly, that concept that you continuously underscore of men's voices being heard and involved in the design of the actual programs that we're actually rolling out for them. It seems so obvious, but how long has it taken us to get to actually doing it, right? Speakers, as we're talking, do circle back to the chat room, because there's some really, really cool material coming up there. So I'd ask you to be mindful of it as we're going through. So now that we've got Bernadette well and truly with us, let's go back to her. Bernadette, we've been talking about, what's cool, inspiring, new about the work that you're involved in specifically with yourself in terms of the new structure and role, of course, and what is it that you want this audience of allies to know about it. By the way, before Bernadette answers the questions, people who are vets, put up your hands. How many vets online? Tell us in the chat. I think I'm at least up to 5 or 6 so far. So we're not badly represented. Thanks. Bernadette, over to you.
Thank you very much. First of all, I'd like to join in acknowledging the elders past, present and emerging. I'm currently on Untitled and Ngambri land, and I wish to acknowledge their elders. I'd also like to thank Darren for inviting me to this engagement with people, and getting as many ideas as possible is really core to what I'm trying to do. I think it was Einstein that said the definition of madness was repeating the things that we've done before and expecting a different result. So I'm very much into trying to look at new and different ways of approaching this issue. In my space, that is the veteran space, we've got about 20 years worth of reports, and people might be quite surprised to know that. This is an issue that has been looked at by a number of academic reports, and also, in fact, quite recently, the Productivity Commission produced an excellent report. Many of those recommendations have been accepted by government, but it's unclear how many of them have actually been implemented. So understanding the complexities of the issue, we're a little bit down that track, I think, building on past work. So we know that a lack of support during the transition from the Defence Force out into the wider community is a hotspot. Lack of planning for that transition, the impact of transition and the difficulties of adjusting to civilian life. And as a veteran myself, I mean, I did 5 years in the regular army. The remaining period of my service was in the reserve. But that transition, even when you're somebody like myself who came into the regular army a little bit later, I was in my 30s when I had some reserve service, but I was in my 30s when I went into the Defence Force full-time, and I know from my own experiences that it's actually quite frightening when you do that step off. It's strange. You should know that it's all out there, but imagining that for somebody, that is me imagining it for somebody who has basically joined from school, done their growing up, and we all know that the brain of young people is not fully developed at 18, and indeed the male brain takes that little bit longer to develop. So we're talking about 25, 26 before the brain is fully formed into the adult version of the brain. And that really, for many young people in the Defence Force, means that their brains are still developing while they're in the Defence Force. They're getting to that emotional, psychological maturity in service life, and suddenly they're walking out the door. We know that family connections and the supportive roles that the family play are really important as a protective factor. There is a lot of concern about the way that the Department of Veteran Affairs handles matters brought to them. There's certainly a lot of concern out in the sorry, I just saw a question pop up, but it's not for me. There's a lot of concern in the community, in the veteran community, about what role of DVA. The disjointed nature and structure of ex-service organisations, people who, with fabulous intentions, are trying to do things for people, but it really just, while there are fabulous things going on, a lot of it's just not coordinated well. So we've got a lot of resources in some areas, and we have a lack of resources. And of course, Zach's already spoken about the issues related to rural and remote areas, and there's no difference for veterans in those spaces. And indeed, many of our veterans like to go to rural and remote areas. So you'll find a higher proportion of people, veterans, in those rural and remote areas. Psychosocial impacts, very important. Relationship breakdowns, drug and alcohol use and abuse, interactions with the justice systems, difficulty accessing mental health and wellbeing services when they're needed. And importantly, and I think particularly for this group of men, the stigma around mental health and wellbeing. It's a very male role being a soldier, a sailor, an airman, particularly perhaps in past times. So some of our older veterans, it's very much a male-focused role. There are a lot more women in the services now, but we're still down at about 30% at the most. So it's still very much a male role. It's a male thing to do, to go to war. So those are some of the things that we know affect people and men in particular. As a coroner, I know that the taking of a person's life has as many reasons as the grains of sand on the beach. So it's a highly complex situation. It's often or usually the culmination of a number of different factors. One of the best things in my role is speaking to people and getting people's perspectives. But it's been very interesting. I've had about 20 round tables. I've spoken to a lot of families and individuals, and also at the symposium that we held. A lot of the themes are actually quite common, which gives me some comfort, because I think it means that we can begin to get a bit of a picture about why. So, I mean, I often say to people, my role is to, my mission is to find out why people are taking their lives and how to prevent that. So we're getting a bit of a picture of why it's happening, but it's that solution issue. We know that mental health services are stretched across Australia. Interestingly, my first degree is in anthropology, and one of my former lecturers is Robin Dunbar, who I suppose blink if you miss it, but his name was actually mentioned on The Big Bang Theory for those of you who are fans of that show. But Robin Dunbar moved from anthropology into the psychology space, and he did quite a bit of work about relationships and relationship maintenance. And we know that strong relationships are a really big protective factor in this space. And he has identified the different ways that men and women build those relationships, and more importantly, maintain those relationships. So it will be common for everybody. We all know that we've got the family, and then we've got our very close friends, and then we have broader friends moving out to acquaintances and the people that we just nod to in the street. And he did some research about how you move from that close friendship to acquaintance. And it's quite fluid. People move around. And the things that stay core are families. Families don't have that. You don't, even if you don't speak to your brother or sister or your cousin or your aunt for maybe years, 12 months. I mean, I came from overseas, and I don't speak to my close family very often because of the tyranny of distance. But we'll just pick up the phone, and it'll be the same as it was when I saw them, a year ago. And that's a thing. But interestingly, if in normal friendships, if you didn't speak to people for a year, they'd drift away. The exception is families and the military. And it's something that people who have been in the military will understand. There's that mateship is a real thing, and indeed it can be identified in the research. And the other interesting thing is the way that men and women maintain those relationships. And I think that's very important when we're in the context of male suicide, because as we know that having a close buddy to speak to is really important. Men maintain relationships by doing things together. So women can pick up the phone and have a chat, and that maintains the person in the close, stops them drifting from the close friend to the more distant realms of friendship. For men, the research tells us that they need to do something with, so if it's going down to the pub, having a drink, going to a men's shed, making something together, being involved in an activity together, whatever that activity may be. But there is a real, supportable by research, difference in the way that men and women maintain their close relationships. And I think that there's something quite important in that. And what that means is what this group can do is about maintaining those friendships with ex-serving male veterans, well, ex-serving is a male veteran, but anyway, maintaining those friendships, being a buddy, but understanding that just being a buddy is more than just picking up the phone and having a chat, important as that is, but it's actually about doing something together. And I think that's where the centres, the veteran centres, are going to be very important. And they're going to be places where men can meet and do things together, not just have a chat, but have a chat over a coffee, have a chat over making something, having a chat from doing something together. And I'd urge everybody in this space, my focus is on ADF and veterans, but to just have your group of friends and do something with them, because that's really important, and that can save lives in my view. And the other issue that I'm really interested in is how that survival instinct, that core human, common to all animals, but core human survival instinct somehow gets switched in people. And I've met many people now where their survival instinct has been turned on its head, and they want to die. And understanding that mechanism, I'm really keen, for your experts out there to understand how that switch gets tripped and how we can switch it back. So, sorry, that was a little bit long-winded, but anyway, thank you.
Not long enough, and fascinating point at the end about that notion of moral injury, and when our brains stop kind of functioning in a way that we can discern what's right for us or wrong for us. Fascinating, right? Also heard a strong message in there from Bernadette about, and aren't we in capable hands, by the way, about transition, about how transition in men's lives can be difficult and risky periods, whether it's transition from the military out, or whether it's transition in a family sense, it's transition in a physiological sense, transition, very sadly, moving out of the formal mental health system into the community, one of the riskiest points, for instance. So yeah, that notion of transition, interesting. The other thing that I heard very much from Bernadette was, those protective factors, that mateship is a real thing, that it's not just a cultural cliche, that it actually has a value, right? A life-saving value. And that notion of doing, right? I saw a really great comment in the chat. It says, whether we agree or not, but it's provocative. It's to engage women, I need to show them I care. To engage men, I must show them I can act. Fascinating, right? Okay, we're going to circle back to Bernadette as well, and let's move now to our next panelist, who is Christopher Stone. And Christopher has a great job that he's currently writing the male-oriented suicide prevention framework for Suicide Prevention Australia, our peak body. So Christopher, why don't you tell us a little bit about, what's really motivating, exciting, interesting, aside from the fact that we're actually doing this piece of work, A, and B, what it is that you need stakeholders to get behind or know about.
Thanks heaps, Pete. And I hope everyone can hear me okay. With exquisite timing, my internet just went down, so I'm hotspotting off my mobile. So fingers crossed that I stay online. And look, Pete, thanks heaps for mentioning that work that we're doing, because it is something that I wanted to bring up. What SPA is doing at the moment is, and I think you described it earlier as historic, and I'm really pleased that you did describe it that way, because we think it's really important. We're looking at doing up a set of principles that we hope that we can then put to government to guide what's happening with male suicide, to try and put to government exactly what strategy they should be implementing. And I say we're doing it, but in actual fact, what I find really empowering about this work is it's not us that's doing it, it's actually the sector. I'm in multiple different conversations with around about 30 different experts on male suicide, and that's been just incredible. And these are a number of these experts are here today. Pete, Darren, and Glenn, and I'm seeing at least a couple of others. And so, yeah, what's really empowering is kind of bringing all of that expertise together and lots of different perspectives. But nonetheless, the commonality is very much coming through. so what these principles have kind of come up with, and they're still in draft at the moment, obviously, but we're looking at ensuring that supports respect and value men's strengths, that they're kind of client-centered for men, that they take a situational approach. We look at the situations where men are actually at risk and go there. Supporting men in all their diversity, take into account different ages, cultures, access needs, all of those things. And very importantly, making sure that all actions and government strategy are informed by lived experience, by the experience of support providers, by research and by data, and genuinely consulting. And it's been really fascinating hearing the other speakers and how much is linking into what's going to be in these principles. One of the key points that came out of this, out of the conversations, was the importance of going to where men are. And so, it was really great to hear Darren talking about, the roadside health checks, for example, and also, the importance of providing men with tools that they can use. And so, again, there's that online content that Darren was mentioning. I will also, I've been scanning the chat as I've been going, and I noticed a couple of questions have cropped up that I might address now, if that's all right, Pete. Awesome. So one of them, and indeed a few of them, have been looking at, how do we provide better service, what works best? And so that's what I'm starting to get into, that, in one of the principles we talk about what is it that makes services work for men. And as I mentioned, supports that go to where men are is really important. Also taking a strengths-based approach, it's really important that, the supports recognize the strengths of being a man and the strengths that men have. As I say, providing tools that men can use in their everyday lives, providing an integrated case management approach also cropped up. So these are things that kind of all services should be doing. In addition to that, some of the discussion was also about what we need, like at a service level. And we need definitely peer-led supports, and we need a variety of different modes of engagement. And obviously, not every service should be peer-led, and not every service is providing different modes of engagement. But the importance is that overall, every single man, wherever they are, whoever they are, has access to that. They have access to peer-led supports when they want them. They have access to different ways of getting at those supports, whether that be phone or text or face-to-face or anything like that. So those are some of the things that come out. One other question I did notice crop up applying specifically to us was, I think James asked about mapping the journey of men. That's really important too. And one of the things that SPA has been doing in that regard is actually a project on mapping the journey generally of those at risk of suicide. And so I'll pop up in the chat a link to our work so far on that. But I think certainly work specifically on men in that model would be a really good idea going forward. So really, that's what I'm finding really empowering about this work, is working with these experts, drawing together all of these ideas about what needs to be done. And it's been fantastic so far. I'm really looking forward to getting these principles and framework out.
And we look forward to it. And a couple of key messages there from Christopher, going to men with services rather than some sort of magical expectation that they somehow rock up. And going with men, in terms of the way they think, their strengths, their language, their professions, et cetera, et cetera. So looking forward to those principles. Look, the chat is actually really cool as I'm looking at it, and I'm Glenn and facilitators, conveners, whatever you'd like to call yourselves. I'm going to put the acid on you, if I will. We should actually capture these comments, right? And one of the things that we should do with them is we should, as a board at the Australian Men's Health Foundation, we should actually consider them in the context of our strategic planning. And maybe that's a job also for Chris in terms of looking at these chat comments as well and his work as well. Yeah. So you ain't just typing for the sake of it. I'd like to think that there's some power in your words, right? Okay. Speakers, let's go to another level, and that is where we are in terms of the policies at a federal level that sort of guide work around male suicide prevention, delivery, resource, programs, initiatives. So the biggest milestone at the moment is the final advice of the National Mental Health and Suicide Prevention Advisor, and we'll just call her Christine Morgan because that's who she is, has now been provided to the Commonwealth government. And the way I look at it, there's a kind of glass half full and a glass half empty in that advice when it comes to male suicide. Glass half full, there's clear recognition that men are an at-risk community and that specific effort needs to be applied around men. I mean, now that sounds almost so commonsensical and logical that it's kind of weird coming out of my mouth, but it's actually taken us a long while to get to that point of saying, look, men do actually need to be looked at kind of in a tailored way. So that's glass half full. Glass half empty, if you start to pull apart the recommendations, the substance of them is, guess what? Now that we've decided that men are important, we need to do an audit. And we need to kind of look at what kind of services are delivered by the Commonwealth and the state to see whether they are in fact male friendly or not, and what we should do about it. So I guess, speakers, which side do you lean on, glass half full or glass half empty? And if we are in the business of now doing service audits and gap analyses, et cetera, what are we likely to find? How do we fill up any gaps with, let's say, some of those protective factors that we've started to touch on? In no particular order, go for it, speakers. You decide who wants to go.
Have a fight. I'm happy to.
Go for it, Zach.
Bernadette, you can go. I see you had a thought. I'm sure I'll echo your thoughts, Bernadette. Then you can jump in. I'm fed up with reports. Like, talk about glass half empty, half full. I would drink anything to stop the reports coming.
Mate, I'm trying to be diplomatic.
I just cannot read another report. They shit me beyond belief. But that aside, the thing that I have a lot of respect for Christine Morgan. I have a lot of respect for what is taking place right now. I think we are making moves in the right direction, as I've said. My main issue is that I think we are going to do an audit of sorts. We're going to look at the depth of the problem. We're going to try to plug these holes one way or another. I do not feel that we have the right lens to actually understand what we're looking for. That's one of my main issues. If we are to find a way to fix the system, we need to understand what the system actually is providing men and what type of diversity and strength-based programs and all of these other things that we've all used this lingo left, right, and center to provide men with. We don't actually know what that needs to look like. We don't actually have a good enough context to understand what we should provide, let alone what is actually happening on the ground. So I really do think that we need to, I think, potentially just take a step back before we go, oh, the system is broken, here are the issues. We don't have, as a sector, a good enough idea about what we need to provide instead. And so, there's a lot of talk around, as I said, these buzzwords of strength-based communication, action to empowerment, masculinities, which is the space that I work in. I think we have a really great understanding of how those concepts work within potentially a research setting, but there has been very little translation into real-world broad practice. I think the men's sheds movement is pretty much, largely the only resource that has been both researched and broadly rolled out across Australia. And I think we need to get to the point where we can understand what these services need to look like, what how they can respond to men's needs in all their diversity. And given that, I think that there needs to be a real understanding, as I've said, of what these best practice ideas look like and how we can upskill the workforce rather than try to impart this knowledge upon men and force men to fit into this box so that when they come in, they know exactly how to be the best patient. Because historically, men are criticized for being bad patients. They don't fit within our mold. They don't act accordingly. But instead, we need all mental health professionals to understand what they're looking for, to know how to treat this stuff, to adapt their practices accordingly. I don't think that necessarily we can do this within the existing services framework, if that makes sense. So if we're to just drop a new lens onto a system that already exists and is working as it does, for instance, the Headspace service. I've worked really closely with Headspace, who treats young men, 12 to 25. They keep doing these campaigns to try and get more and more men in. The men come in and then they go, here is our box, now you must fit into it. That simply won't work, and neither will trying to, again, just try to put a new shirt, as Glenn just did, onto an existing model of sorts. It needs to have a full dissection of sorts, and we need to look at within each component of these services what is actually meaningfully able to change here, and how are we going to go about that from the way that the room looks, from the way that we're offering and speaking to these men, from the types of appointments that we can provide them, left, right, and center. It cannot purely be a superficial shift here that comes with a gendered lens. I just feel it's much deeper than that, and we need to offer really, really tangible ideas. And that's why I do the work that I do. I've created an 8-hour, training program with Movember that is really focused on giving an in-depth foundational knowledge to these practitioners to understand how they can unpick and repack their practice, rather than dressing the emperor in new clothes, I guess, in some ways. So yes. Enough with the reports, and it's about time that we get a bit deeper than that and offer strategies that aren't purely surface level, but rather dig deeper and go. And it's uncomfortable. It is fundamentally uncomfortable. I've studied for way too many years. I am still trying to do that thing where I'm fitting a square peg into a round hole with my own practice as well. It would have been great at the start of my training to have gotten this lens rather than trying to fit it in retrospectively.
Yeah, look, Zach is expressing quite a sophisticated and nuanced perspective here, e.g. that, let's not just look at the system that's already kind of flawed and say, where are the flaws when it comes to men? But let's do the alternative, and that's actually define what we believe as men actually is a best practice and what is working, and et cetera, et cetera. And in some respects, that involves more work and more responsibility, but it also has a probability of being more successful than effectively what you're suggesting, a bureaucratic approach that basically says, I've lined up all the programs. These are the ones that have the right male vocabulary. These are the ones that don't, right? Let's hold that thought. That's actually quite provocative in a good way. Panelists?
Yep. Peter, I'm happy to weigh in.
Go for it, Matt.
Well, I think the notion of an audit of services is actually a good idea. And so I'm going to come in glass half full. And I think the work that Bernadette is doing is part of that, but with a very specific lens on veterans. But we did some work, just to go to another subset of high-risk cohort. We did some independent work for the AFP just in 2019, and it was an audit effectively of their mental health and suicide prevention services. And one of our key findings really simply was that there wasn't a lack of services. They were well resourced internally, but there was a lack of appetite to actually access and use those services. So that was a factor. And now that we're working with truck drivers, for example, we're finding, again, there's over a dozen different programs and services that have stood up in the last 2 years, all focused on health, well-being, safety, fatigue management, mental health. So there's not a lack of services. There's not a lack of goodwill and enterprise. And to use a military term that many of you will be familiar with, I think one of the key issues is a lack of command, control, and communication. So it is clear. It is clear in industry. It is clear in the veterans space. It's clear in police and emergency services that, in fact, it's not a lack of goodwill. It's not a lack of strategy and planning. It's not a lack of services. But one of the key gaps, and one of the reasons I think an audit is a good idea at a high level, is that we've got significant gaps in service delivery, and we've got significant overlaps and duplication.
Darren, would you use another military term and call that significant lack of coordination a clusterfuck?
Peter, I tend to try and be more diplomatic. But yeah, look, there's a shitload of stuff going on out there. But clearly, according to, the evidence and the facts would say collectively we're not being effective. So if you look at effect and impact, despite all of the good intent and programs and activities out there, the lack of that coordination, facilitation, I think is a key factor. And hence I just say, I think an audit to try and identify the gaps and the overlaps is a good idea.
As somebody writing, regrettably, yet another report, although hopefully when I get some legislation, I'll be doing a bit more than that. I agree completely. I'm glass half full in terms of the audit, because as I go around the country at the round tables, as I say, I've spoken to some of the ex-service organisations. I mean, there's 3,000 or 4,000 of them. They're not, that's not gripped up. It's just not gripped up. There is no command and control, overarching policy, code of conduct, or anything that's sitting over the top of that. So you've got, 3,000 or 4,000 organisations providing stuff, and nobody really knows. Well, for a start, most people don't actually even know about them, which is a problem in and of itself. But there's also different layers of government. I've also been having roundtables with government organisations. There's Commonwealth services being provided. There's state and territory services being provided. There's local government services being provided. So even in the public sector, we haven't really got a good handle on the services being provided to veterans. And I can only imagine that would be extrapolated across all services for men more generally. So I think an audit, as depressing as it sounds, we live in an industrialised time. Our processes are industrialised. I'm not sure that we could really, the government focuses its money based on industrialised processes like reports and audits. So while personally I'd prefer a green field and a blue sky, it's inevitable that in order to get the resources in the right place and coordinated, we need to know what's going on. Then there needs to be a level of organisation put over the top of that. And only then are we going to be able to step forward. So I completely agree. I think the audit is a half full measure, and we need to then build on that in order to coordinate. Thank you.
I guess, can I add, and I think like some of the other speakers, I'm positive about the audit, although I guess my concerns, and maybe this is just an issue of language, but language matters. I'm not sure I really like the term audit. I think that there's a huge amount of good stuff that's going on out there. Often at the grassroots, often unfunded, with government unaware of it. I think certainly an exercise in mapping good practice and mapping gaps is a really good idea. Not sure calling it an audit quite gets at what we really want there. The other thing I guess I'd say is that although I'm very supportive of this kind of process to actually find out what's going on and what's not going on, there also, in order to avoid the danger of it being yet another report, there needs to be kind of an action plan of what next. If there is, like, where we do identify areas of good practice and where we do identify areas of gaps, we need to say, okay, how are we getting that good practice and spreading it? How are we addressing those gaps? There needs to be some sort of quality improvement program that kind of sits at the end of that process to make sure that we're building up the sector and doing indeed what I think the whole sector wants, is to do a better job at helping men at risk. So those would be my comments.
Okay, so some interesting perspectives there, and yeah, that is going to be a big challenge, if you will, for government and for ourselves, is to actually work out what are we actually talking about, what are the parameters, the scope, of what comes next? Is it simply a kind of tick a box exercise, or can it be some of those aspirations that Zach talks about and Bernadette talks about and Chris talks about? We're going to, we were going to talk about the following, COVID and its sort of implications, but I'm thinking we're going to change that a little bit. The only comment I'd also add to the last discussion is one of the things that we would want to know about the last 12 months, even since the last time we gathered on these kind of Zoom calls, is the massive amount of growth of grassroots activism around these issues. Yeah. So almost every day when each and every one of us flicks on the computer, you can find some evidence of a new initiative by men, who are simply getting together, whether it's, in the form of an organization or it's in the form of a barbecue. The number of organizations that's been founded and launched in the last 12 months has been extraordinary. So it's a sign of men taking responsibility around their own well-being. It may not have coordination, it may not have structure, it may not have overarching principles, but it's certainly reflecting a desire by men to do things for themselves. Yeah. And I wonder how we capture that in terms of policy, funding, et cetera, et cetera. So he's been sitting there very quietly this whole time. You thought that you had a fourth panelist named Glenn Poole. You actually do. And what he's going to do right now is he's actually going to have a crack at a bit of a summation, right? We said nothing's going to get lost here. So Glenn's going to have the impossible task of, over the next few minutes, telling us what are the major themes that have emerged from our panelists, from our comments, et cetera, et cetera. Glenn, if you had to write a report out of this session, what would it say and how can we make it important? And then we're going to give every panelist a chance to comment on the Glenn report.
Yeah, so that would be easy, right? Thanks, Pete, because that would just be 3 words. It'd be no more reports. So that, job done. I'm going to use a bit of pre-existing framework that I've been focused on for the last 4 or 5 years, to help focus my work, the 5 key areas that I focus on and how they've resonated through the conversation today. So and to make them easy, they all begin with R, right? So the first thing I've been saying, and many before me have been saying, is we need to rethink the way we approach male suicide. That commonly our narrative was that suicide is a mental health issue. Men aren't as good as talking about their mental health as women, therefore more men suicide. And for many years, people like Professor John McDonald here were championing the situational approach, which recognized that the pathways to suicide for men often weren't directly through mental health, but more often through some of those social factors like divorce and financial issues. And I've been speaking with older men recently, bereavement and loss and loss of physical health and all these other distresses in addition to what we commonly call mental health. And it's great to hear Suicide Prevention Australia, Chris Stone, saying that the situational approach is a key part to how we want to see male suicide addressed. And, Professor John McDonald, we stand on your shoulders in terms of bringing that narrative to the table. So we need to rethink that, and we are, and it's happening. And I heard that here today. And the next one is reform. We need to reform the way we deliver services rather than just simply saying we need to get more men to get help. We need to get better at giving men help. And we're hearing, everything that Zach said is so focused on that. Zach is telling us this story. Men are getting help, but the help they're getting often isn't doing the job. And so that's a really key message, which is now getting out there, and really high quality work is being done, both at that clinical research level in terms of focusing on what makes a service work for men. But also, you mentioned it, Pete, that upsurge of grassroots organizations run for blokes by blokes, which is really wrestling with that. How do we make approaches? And I heard it in what Bernadette was saying about around mateship and action and talking about the Sheds movement. The third R is really listen. We've got to really listen to men, because often we're talking about men. often the suicide prevention space is dominated by more female voices for all sorts of reasons. And we don't want less women engaged in suicide prevention, but we do need more men engaged in suicide prevention. And we've got a whole session this afternoon on men's lived experience of suicide. So both in terms of men's lived experience of suicide, but also just blokes getting involved and saying, blokes are saying, we want to be involved, we want to help. We need to listen to that and respond to that. We haven't talked about it too much, but we do need to reimagine the way we think about and talk about masculinity. And what I've heard today is both that championing of the strengths-based approach, recognizing the existing values of masculinity that we can draw on. Bernadette talked about the power of mateship, action-orientated approaches. Chris mentioned it in the Principles of Suicide Prevention Australia. But, Zach also talked about masculinities, and we can't get stuck on there's only one form of masculinity. We need to work for men and boys in all their diversity, not just different populations like Aboriginal Torres Strait Islanders, young men, old men, but men with different ways of expressing masculinity. And we need to work to allow new forms of masculine expression to emerge, but not throw the baby out with the bathwater, because those strengths-based values are really important. And finally, we need to offer rally. We need advocacy. And I like to champion the Australian Men's Health Forum. The fact that we've had a peak body funded by the Department of Health for the last 4 years has meant that we have been able to get into some of the rooms where we can influence the policy landscape. And we are influencing the policy landscape. So I lean towards the more sort of glass half full, like Darren and Chris, around the audit. The audit is actually a positive opportunity, but we've got to make sure that actually it's not just something that remains on paper. And we need men's health advocates involved in that, in every state and territory, holding the auditors' feet to the fire and making sure that those audits are done with all these principles in mind. And not only are those audits done, but that we follow through with actual practical action. All the types of practical action we've heard about here, particularly the whole idea that services need to be designed male-friendly with blokes in mind. So I've heard a lot here to be positive about. And I think the important thing that always comes from this space is the power of us working together and creating as much as we can. Not necessarily a collective voice, because we have many different voices, but collective platforms where some of those strong voices can be heard in harmony.
Okay, so here we go. Rapid fire round with 4 minutes left. Panelists, tell me what you think most resonates for you out of either out of Glenn's summation or other things that you've heard today. What are you going to reflect on the most going out of this? Equally, those playing at home in the chat, what's the key thing that resonated for you today? Here we go. Panelists, Darren.
Oh, okay. 2 quick points. Picking up commentary from both Chris and Bernadette. Bernadette talked about protective factors. Chris talked about peer support networks, and again, to coin an old military term, we used to use the term esprit de corps, and it goes to mateship and camaraderie, and those building those strong connections across cohorts. We're even seeing it now. We're seeing the importance of it with truck drivers. We're seeing the importance with farmers and men in regional communities, taking the service to them, to cattle sale yards, to truck stops, to roadhouses, to abattoirs, and where the men are, and helping them to build those peer networks and arm them and equip them as well. I think so critical. Building those peer support networks and enabling men to support both themselves and each other. I think we know that's so important, whether it's in the military context, an emergency services context, or with different industries of male-dominated cohorts. So that's a key takeaway for me today. And, I think it's really positive that we've got so many different people now involved in the conversation, and the diversity of support and interest in focusing on male mental health and male suicide is a critical part of us improving that circumstance moving forward. So thanks, great to be part of it.
Christopher, and then Bernadette. Bernadette gets the last word.
Great, thanks. Look, great summary, Glenn. Loved all of it. I think all of it resonated. But look, two points in particular. One, the point you raise about masculinities, and it is a really important and difficult discussion to talk about. Both masculinities as protective factors, but also as risk factors. And that we need to kind of get more of a handle on that as we're improving services for men. So that's really important and needs further discussion, I think. But and coming off that, the point you made about coming together, not with the same voice, because we have different voices, and we are going to have different voices, and that's important. But different voices coming together, and that's certainly some of the work I'm trying to do in the framework that we're putting together. But it's great that you mentioned it. So those would be my thoughts.
And Bernadette.
Thank you. The irony of a woman having the last word is not lost on me, but I'm really impressed by the rethink, reform, rally, reimagine, and really listen. I really like those. And I know that's being a bit saying, well, everything, but the rethink for me, of those, the rethink, as I said it earlier on, we need to do things differently, because we're just going to repeat the same failure if we don't. As I said earlier, these issues, for example, moral injury, it's new, an emerging field. It's something I'm really interested in looking at. And I think that moral injury really is a lens through which we can look at all 5 of those points. Traumatic brain injury is another area I think that's new and emerging. The use of different ways to approach things. And at the symposium, we had a speaker who spoke about the psychedelic drug use in this space. That's new and emerging. I don't know whether it's right or wrong. I'm not expressing a view in it, but I think we need to look at it. We need to look at the new, the different, while not throwing the baby out with the bathwater. And I think that's also a really important point. So, as I say, all 5 of those, I really like that. I want to appropriate those a bit, but the rethink is key in my opinion. Thank you.
I want to thank our panelists. They've been awesome. I think you'll agree. I've learned a lot, and I'm going to actually test some of it today. So I don't wear this shit for just shits and giggles. I actually do have a yard that I got to go to this afternoon, and I've got a bunch of blokes out there who are tearing apart bicycles for recycling, et cetera, et cetera. So when I talk to them, and they're Somali guys and Nigerian guys and other kind of guys, I might actually figure out, how do I take rethink and put it into a conversation about mental health with the blokes stripping bikes today. Thank you very much. Congratulations, AMHF. Job well done. The comments will be captured, and we will do something successful and good with them. Bernadette, Darren, Chris, Glenn, champions, thank you very much.